Our goal is to prepare our graduates to be able to lead and advocate for patients, for the public, for the nursing profession.
Our purpose is to develop executive nurse leaders who will be able to go out into the healthcare arena and manage healthcare systems.
We expect them to be able to sit at the board table with the highest levels of administrators and executives and speak confidently and competently about healthcare issues, about policies that affect healthcare.
When the student enrolls in Thomas Edison, they're already starting to think about how do they want to make a practice change. So as they take course after course, they're learning more and more what that project is really going to be, to be about.
Every course is designed to build the level of knowledge, the theory behind the project. It builds from semester to semester.
The DNP project is different from a doctoral dissertation that a student might do in a PhD program. The goal of the DNP project needs to be improvement of patient and/or population health outcomes. It is a practice-oriented project that uses the best available evidence out there.
The student really embraces a topic, something that they're passionate about, something that the organization really would like to make a change with, and the student works with the organization to, make that project successful.
I've been a nurse for 38 years. And a long time ago, very early on, I got very upset when a patient that I was caring for fell. And from that day forward, I said, I need to do everything I can do to not let that happen again on my watch. The title of my DNP project is, What is the Influence of Video Monitoring on Falls Reduction and Sitter Utilization in an Acute Care Environment? What I hope to achieve is to come up with, to determine and identify the right type of patient that is appropriate for video monitoring. At the same time, I can reduce costs for the organization by reducing sitter utilization and at the same time reducing inpatient falls.
As far as the nursing projects are concerned, the sky is the limit. And what I see both as a mentor and in my role as a clinical editor, the manuscripts we receive lately from DNPs and DNP projects is how vast the role of the nurse is and how many different areas of population health we can be involved in.
We don't want this just to be an academic exercise. We want the DNP project to be something that's needed, something that's going to make a difference for the organization, something that's going to make a difference for patient care, for population health. So it needs to be unique, it needs to be innovative, and it needs to be something that perhaps can be replicated in other organizations at a future time.
As a committee chair of the DNP projects, I work closely with the student and the preceptor to help facilitate their project along the 18 months during where the student is working on in the program. I oversee the student. We help them move across through each course and move forward in the project.
My role is to be the primary point of contact for the students here at the university in helping them to explore, brainstorm, develop, and implement a DNP project which has specific focus. The course mentor is really guiding the academic part of that to make sure that the student is developing the project properly, that the final report is written properly, that the course objectives are met.
Mentors here at Thomas Edison really are very actively engaged in the education with the student. They don't just monitor activity online. They actually are bringing articles to the students. They're engaging in scholarly activities that happen online through the assignments. There is active engagement and a feedback loop about those assignments, so it's a very active role. The preceptor's role is really to partner with the student very directly in the practice setting where the project's going to happen, to really help that student navigate the intricacies within that organization through the IRB process so that when they implement their project, it really is successful.
My preceptor has a PhD in communication organizational development, and she also has done a lot of work in faith-based communities. She meets with me regularly. She's very engaged and interested in the project. She's helped me through the IRB process, is constantly looking for meetings and activities and events that coincide with what the learning objectives are for the courses I have, so that I've really had a wonderful experience in the practicum site.
The unexpected will always happen. And they're there to try and navigate the sometimes stormy waters.
Do they need special permissions from certain departments? Who is the person at the institutional review board that will help the student write and submit that institutional review board application and proposal? And again, help the student with introducing the student to the key stakeholders that will be needed to participate or give approvals for the student's DMP project.
I think the hardest obstacle hasn't been guidance from any of the people in the roles. It's more, I would say, managing two IRB processes in two different organizations. So you have your practicum site IRB process and the proposal, and there is a format that's required to be submitted, and then there's a different format and a process and a timeline for the college.
It's hard work, but I think at the end, there's such a great sense of accomplishment. What they, in some of the projects that we've seen our students working on. So it's busy, but take time to smell the roses and really enjoy the intellectual stimulation that they'll get.